Hi, I'm Tom Lynch, and this is Two Things. Today I'm delighted to be joined by Katrina Armstrong. Katrina is the Jackson Professor of Medicine and the Chief of Medicine at the MGH. Last week, Katrina, you had a spectacular article in the New England Journal that talked about the contribution that immigrants have made to medical education and the medical system in the United States. Given how topical and important this is to our country, what are some of your thoughts on where we stand and how, as a medical community and as a hospital, we need to respond and think about these issues?
Well, Tom, I couldn't agree more that this is an incredibly important issue these days. And obviously, with the political environment around us and a lot of debate about the role of immigrants, and particularly from certain countries, I want to be clear. But I think what we believe is that immigrants are fundamental to both how we deliver medicine here at the MGH, but across the country, to biomedical research, and also obviously to education and how we lead across the globe and thinking about improving health in lots of communities. I'll tell you a story, so it turns out that my first day here, as I think you know, was the Boston Marathon bombing. It's an incredible time to enter a community when we really had just experienced a terrorist attack, saw what hospitals could do for the community at that time, saving lives. And as you probably know, the leader of our trauma service, Dr. George Velmahost, was really widely recognized for the impact that he had at that time. And actually, George was born in Greece, so came to our country to pursue his belief of how he could make a better place for doing medicine, to pursue his career. And so if you just think about that individual story, it's such a great example of what it means to bring the best talent to our country to take care of patients, but also to move forward in research.
And I guess one of the questions I would have is, what's the reaction that you've gotten from your article last week? I'm sure people have emailed you or texted you or sent Twitter messages to you about this.
Well, I have a lot more LinkedIn requests right now, I will say, so I don't know. I've yet to figure out exactly what to do with LinkedIn, but I will say that my LinkedIn requests have gone way up. I think that, what I would say about the article last week was that a lot of people are writing and thinking about the impacts to our medical system. What I really wanted to do was to bring together a group of leaders from across academic medicine, because I think at this time we really need to reach out to other institutions that share our values, that have led in biomedical research and in medical education, and come together really to show why this is so important.
And the institutions that were on your paper were which institutions?
Well, so we really looked at the places that really we share match lists with, so institutions where the trainees are going, often picking between these institutions, because I think that's such an important part of the values of who we are. And so those included University of Pennsylvania, so where I came from before, Johns Hopkins, of course Brigham and BI, and then we also included UCSF and University of Michigan, really understanding that it's this diversity across the country of leading academic institutions that can stand together right now.
And I guess one last question is, what can we do at the MGH to make people feel included and safe and part of our community when we go through this very difficult time of debate nationally?
Well, I think, there's been a lot of challenges in this, Tom. I think a lot of people feel uncomfortable about when are they moving to a political statement and when are we really affirming what are our principles that stand behind medicine, stand behind the MGH. And I think it's really important that we stand up and affirm those principles. Principles of the fact that we are here to relieve suffering, to take care of everyone, no matter where they came from and who they are. Principles that we believe in the truth and the pursuit of scientific truth. And I think fundamentally that we respect fundamental human dignity, that we're here to take care of all individuals. And I would argue that this time it couldn't be more important to identify those principles as essentially apolitical. These are not a political issue. This is what it means to be a doctor in an institution. At the same time, we have to be open-minded. We have to listen and understand why people have the beliefs they have now, why people are getting to these decisions, that we're concerned about their impact upon medicine. So it's this balance between being even clearer about what we stand for, but also open-minded and actively listening and learning about what these issues are.
And Dr. Armstrong, I could not imagine you saying that any clearer and articulating any better what the MGH is all about. I'm Tom Lynch, and that's Two Things.